Welcome to this podcast from Neurogastroenterology and Motility. It publishes original research and topical reviews on basic and clinical aspects of gastrointestinal sensation and motility, as well as brain-gut interactions.
So welcome everyone to this month's podcast from Neurogastroenterology and Motility. My name's Adam Farmer and I'm a gastroenterologist at the Wingate Institute in London. This month it's my great pleasure to welcome Professor Frank Zerbib. Frank's a Professor of Gastroenterology at Bordeaux University and has wide-ranging interests in the physiology of the gastrointestinal tract. So Frank, welcome to today's podcast and many congratulations to you and your co-authors on your fantastic paper entitled 24-Hour Impedance Monitoring on Therapy to Select Patients with Refractory Reflux Symptoms for Anti-Reflux Surgery, a single-centre retrospective study. So Frank, what are the causes of drug-refractory reflux disease?
I think that one of the most important causes of refractoriness to PPIs is the absence of reflux. And many of these patients who do have symptoms that persist despite the PPI therapy don't have reflux-related symptoms. And that's why we need some investigation to select the patients that may be candidates for surgery. The other important cause may be non-acid reflux, which may persist on PPI and is considered to be responsible for approximately 30 to 40% of refractory symptoms in patients.
So in patients with drug-refractory reflux disease, many consider anti-reflux surgery as a therapeutic option. For perhaps some of our less experienced listeners, could you describe the surgery that's performed in this context?
Well, basically the surgery that could be proposed in this patient is what we call the fundoplication, which consists in making a wrap around the lower esophagus with the stomach. So this is the most frequently performed procedure, which is usually a 270 degrees wrap. It is the most frequently done. Sometimes it's a complete wrap, 360 degrees. Sometimes a half wrap of 180 degrees. But I think that nowadays the most frequently procedure performed is 270 degrees wrap.
And what are the overall outcomes for anti-reflux surgery in most patients? Is this something that tends to benefit patients?
Yes, of course. It's fundoplication is a very effective treatment for reflux, provided you have well-selected your patients. But if in well-selected patients, we can say that approximately 90% of these patients will have a good, favorable outcome after fundoplication. These figures are obtained in patients who are a proven reflux and a good response to PPIs. Provided you have these two conditions, you can expect a very good outcome after surgery.
So is there a consensus, therefore, about which patients we should be selecting for surgery then, given that I think across many healthcare economies, surgery is costly, and obviously we can't offer surgery to all of our patients. So why is there no consensus regarding patient selection?
We have the problem to build a consensus is that we need prospective outcome studies, and these studies are lacking. Most studies that we have are retrospective, and most of them have been done in patients off PPIs with classical conventional pH monitoring. The problem is that nowadays we have many patients who are investigating on PPIs with pH-impedance monitoring, and despite the widespread use of this technology, we don't have solid data to we don't have solid data based on the result of this kind of investigation. So some investigators consider that patients should be tested on PPIs, but we lack solid data to support this, and some others consider that we need the patient to be tested off PPIs because we have more solid data to support this.
So what was your hypothesis as you embarked on your study?
So what we regarding what I've just said before, we are performing quite a lot of pH impedance monitoring on PPIs in patients who are potential candidates for surgery. So we wanted to identify the parameters that may be associated with outcome after anti-reflux surgery. These parameters obtained on PPI with pH impedance monitoring.
And what was the population that you looked at, and what methods did you use to look at your data?
So we investigating a population of patients with refractory symptoms to PPIs who had an operation, who had a surgery, a fund application in our center, and who had been investigated preoperatively by pH impedance monitoring on PPIs. And then we looked at the outcome of surgery and make the comparison between patients with good outcome and patients with bad outcome.
And how did you define the whether they had a good or a bad outcome? Were these patient-reported measures?
Yes, we use questionnaires. We use two types of questionnaire. We use the RDQ questionnaire, which is a validated questionnaire which is used in many studies, and we use also a more practical and very simple and quite old questionnaire, which is the VISIC questionnaire, which is basically, are you doing well or not? And it is based on patients' evaluation. I'm doing well or I'm not doing well. And then the two questionnaires correlated very well, in fact.
And what were your key results to come out from your study, in your opinion?
So I think that one of the most important results, and I would say maybe quite disappointed, is that we did not identify any pH impedance parameter associated with outcome. I mean, we couldn't show that the number of reflux, the number of acid or non-acid reflux, the bolus exposure, acid exposure on PPI, none of these parameters were associated with favorable outcome of surgery. The only factor associated with favorable outcome was the positive symptom association analysis based on the result of the SAP, which is symptom association probability. SAP is a statistical test which evaluates the probability that the symptoms reported by the patients are related to the reflux events.
And so how do you interpret these new data in the wider context of the field as we stand?
I think that these results are interesting because they are quite new, and they are obtained based on the results of the surgery in a population of patients with good and bad outcome, which is one of the first study to do that, because most of the surgical series published before, which aim at evaluate this technique, they are all the patients, or virtually all the patients, had good favorable outcome. So you didn't, with this study, you couldn't with these studies identify any factors associated with the outcome, because all the patients were doing well. So with this study, we try, and for the first time, to compare the relevance of the preoperative pH impedance monitoring on PPIs, and we found that a positive SAP were the only parameter associated with successful outcome. I think it is quite important, but we have to perform prospective studies on probably a bigger sample of patients because it is a very preliminary study and with quite a lot of limitations.
Yeah, so you mentioned some of the limitations there, and I think certainly, as you say, a prospective multi-center study would certainly help answer this question.
Yes, this study has several limitations. It is a retrospective study. We included quite a small proportion of patients compared to the total number of patients who had surgery during the same period of time. So there is a bias. Why did these patients have the preoperative pH impedance monitoring? We didn't have any control of the reflux post-operatively. It would have been interesting to correlate the bad outcome with the results of a pH impedance monitoring in the post-operative period. So that's why this can be done only in a prospective study.
Absolutely. So moving forward, where do you think the knowledge gaps really lie in the field of helping to predict outcomes to surgery, and how do we go about resolving these to improve the management and indeed outcomes to surgery in future?
It's a very difficult question to answer, I would say. I think that it is a difficult study to perform to include patients for surgery, whatever the results of the preoperative assessments. But it is the only way to establish the relevance of these assessments. So what could be done, and I know it is done by some investigators, it's to include patients on the basis of positive pH or pH impedance monitoring on PPI, because we are sure to include to select for surgery only patients with abnormal reflux of therapy, and I would perform a pH impedance monitoring on PPI, but I would not take into account the results of this study, and I would go back afterwards to correlate the outcome of surgery and the preoperative assessments. It is what I would say I would do, but it is quite a difficult study to perform.
Well, with that, Frank, I'd like to thank you and your co-authors very much for really an excellent paper, and I think it provides a great insight into how we look at these patients. And I'd also like to thank our listeners, of course, for tuning in, and I look forward to welcoming you again on another instalment of the podcast next month.
Further information about this paper can be found on the journal website. We hope that you have enjoyed this podcast, and we look forward to welcoming you to next month's edition.